Hello, viewers. Dr. Hayworth here. Hemostatic quilting netting sutures. What are they? They are employed generally after classic type facelifts. What's a classic type facelift? Classic type facelift is one that involves an incision in and around and behind the ear in order to gain access to the area below the skin so that the surgeon can tighten the muscles. In other words, working on the submuscular aponeurotic system, which is the fancy terminology for the fascia that envelops the muscles. So you're tightening the muscles. And you can tighten the muscles in certain ways that will be called a deep plane facelift. You can tighten the muscles in such a way as to be called a Weissmass facelift, or a smash facelift, or a highest mass facelift, or a compound facelift, etc., etc. But suffice it to say, you need to elevate the skin to gain access to the deeper fascial layer so that we can tighten it. That's the basis of any modern classic facelift. Now, because you're elevating the skin, there's going to be a potential space in there. And after all the dissection and surgery, that space can fill up with fluid and sometimes blood. The biggest risk, or the highest risk of that, is in the first 12 hours after surgery. So even if we put drains in the area to minimize that accumulation of fluid, it can still happen. In fact, fun factoid, men are 7 times more likely to suffer from a hematoma because of their robust blood supply of the skin in the face because of a beard, as well as the fact that they are just men. So that can accumulate. So I was at a conference a few years ago, and this one surgeon was basically highlighting his way of minimizing chances of fluid collection and avoiding the need for drains, and that was with these hemostatic netting quilting sutures, where you may have seen them on your favorite social media platforms such as Instagram, where the patient has a facelift, but they have, as they're being woken up, this weird sort of checkerboard quilting black sutures all over their face and neck, similar to the evil, malevolent character of Hellraiser. So the purpose of those said Hellraiser sutures is to coapt, or to attach the overlying, remember, lifted up skin to the deep fascia. So you're closing it. And they do them through these through and through stitches. Those stitches, of course, are removed in due course soon after. So I like the idea, and I had some good results. I said, wow, this is the way to go in the first few cases. Always beginner's luck, right? But then I had a few patients where the sutures left marks and sort of linear scars, even though the patient had no necrosis or problems with the skin or anything like that. And that became a real bear. So we just need 1 or 2 of these problems, and a patient that's complaining of such, that makes us evaluate these new techniques. Is it really worth it? And so in a case like that, I've decided to abandon them. There was also another issue, that despite the fact that perhaps it minimized the occurrence of large hematomas, or seromas, which are the fancy word for little fluid collections, it did not minimize the little micro sequestrations or ponds of fluid that can develop in between those sutures. And then that was a bear in terms of having to numb the patient and put the patient through the added discomfort postoperatively of having to drain those individual little ponds of fluid. And that wasn't good for anyone involved. So that's my take on the quilting sutures. We all have our journeys in life, and regardless of our profession, if we're passionate about it, we continue to evaluate new methodologies, incorporate them, and evaluate them. And if they turn to be very useful for our patients and for ourselves, we'll keep them incorporated. Otherwise, we'll evaluate them and discard them appropriately. Have a good day.